Question number 1. What is the client's first step when learning the proper technique to descend stairs using axilla crutches after being placed in a leg cast due to a fractured right tibia? A. Place both crutches on the first step. B. Place the left foot and right crutch on the first step. C. Place the right foot and left crutch on the first step. D. Place the right foot on the first step. And the correct answer is A. Question number 2. What instructions should the nurse give to an older adult with chest pain and shortness of breath who has been prescribed nitroglycerin tablets? A. Chew the tablet until it is dissolved. B. Put the tablet under the tongue until it is absorbed. C. Place the tablet between the cheek and gums until it disappears. D. Swallow the tablet with 100 milliliters of water. And the correct answer is B. Question number 3. Which vitamin deficiencies is the child with cystic fibrosis at risk for? A. Biotin and folic acid. B. Vitamin C, B12 and K. C. Vit A, Vit D, and Vit E. D. Pantothenic acid and Vit B2. And the correct answer is C. Question number 4. Considering the condition of the client, who is experiencing chest pain rated at 8 on a 10-point visual analog scale, along with ST elevation in the inferior leads observed on the 12-lead electrocardiogram, and elevated troponin levels, the primary focus for nursing management of this patient should be on prioritizing the following. A. Educate the client on prescribed medications and dietary recommendations. B. Assess daily weights and urine output. C. Implement measures to alleviate pain and reduce myocardial oxygen demand. D. Permit unrestricted visitation by family and friends. And the correct answer is C. Question number 5. Which of the following equipment options will assist a patient with a total hip replacement in performing activities of daily living ADL? A. Abduction pillow. B. High seat commode. C. Recliner. D. Spinal traction system. And the correct answer is A. Question number 6. What should the nurse prioritize first when caring for a client diagnosed with an anterior myocardial infarction 2 days ago and identified with a systolic murmur at the apex during assessment? A. Evaluate heart sounds with the client leaning forward. B. Obtain a 12-lead electrocardiogram. C. Draw an arterial blood gas. D. Assess for changes in vital signs, that is heart rate, blood pressure, and respirations. And the correct answer is D. Question number 7. What are the desired effects of intravenous morphine sulfate for a client with acute chest pain? Select all that apply. A. Alleviates anxiety and fear stand coast. B. Promotes a decrease in respiratory rate. C. Lowers blood pressure and heart rate. D. Prevents ventricular remodeling. E. Reduces myocardial oxygen consumption. And the correct answer is A, C, and E. Question number 8. What is the most critical assessment for the nurse initiating the nitroglycerin drip in a client with chest pain? A. ST elevation is present on the electrocardiogram. B. Blood pressure is 90/48. C. Serum calcium 10 mg/dl. D. Heart rate is 60. And the correct answer is B. Question number 9. The nurse observes a client's heart rate decreasing from 68 to 48 bpm on the monitor to determine the appropriate course of action. The nurse should first A. Measure the client's blood pressure to assess their cardiovascular status. B. Auscultate for any abnormal heart sounds. C. Prepare for the possibility of transcutaneous pacing. D. Administer atropine 0.5 mg for push. And the correct answer is A. Question number 10. Patient undergoing chemotherapy is presenting with stomatitis. What supportive measures or interventions should the healthcare provider consider offering to the patient? A. Offering warm saline rinses 4 times daily. B. Providing instructions for vigorous oral care with the commercial mouthwash. C. Recommending the consumption of lots of ice chips between meals. D. Suggesting the inclusion of hot soups for each meal. And the correct answer is A. Question number 11. 65-year-old male patient with the diagnosis of myasthenia gravis has a nasogastric NG tube in place and suddenly experiences a cessation of drainage. Describe the appropriate initial action that a nurse should take to address this situation and ensure the proper functioning of the NG tube. A. Check tube placement. B. Clamp for 30 minutes. C. Retract NG tube 6 centimeters. D. Instill 40 milliliters of water via NG tube. And the correct answer is A. Question number 12. The nurse has conducted a comprehensive assessment on a client who presents with a reduced cardiac output. Considering the client's condition, certain findings should be prioritized due to their critical nature. What criteria should be used to determine the findings deserving of the highest priority? A. Weight gain of 1,000 grams in 4 days. BP 120/85. Mild dyspnea with exercise. B. Urine output 10 milliliters over the last 2 hours. Orthopnea, confusion. C. SpO 293 on 2 liters nasal cannula respirations. 18. 1+ edema of lower extremities. D. BP 130/70 seconds. Atrial fibrillation with HR 78 by basilar crackles. And the correct answer is B. Question number 13. A patient is admitted to the hospital with a burn injury and is in the process of recovery. The healthcare team wants to ensure the patient's nutrition supports healing. Considering the patient's condition, which meal option would be most suitable to promote healing for this individual? A. Chicken breast, oranges, kiwi, and milk. B. Pasta marinara, garlic bread, and peanut butter. C. Ginger ale and jelly sandwich. Banana and coffee. D. Pork chop, fried potatoes. And T. And the correct answer is A. Question number 14. The nurse is educating a client with hypertension on the proper administration of atenolol. What instructions should the nurse provide to the client? A. Follow a sodium-restricted diet of grams per day. B. Avoid abruptly discontinuing the medication. C. Monitor blood pressure annually. D. Decrease the medication if experiencing severe headaches. And the correct answer is B. Question number 15. An unmarried college student at 8 weeks of pregnancy is considering an abortion. What's the typical procedure for this stage? A. Dilatation and vacuum extraction. B. Dilation and curettage. C. Saline induction. D. Cycle-based extraction or menstrual extraction. And the correct answer is A. Question number 16. How can a nurse support parents facing their leukemia child's impending death? A. Losing a 10-year-old is tougher than a younger child's loss. B. Being aware of a grim outlook aids preparation. C. Families feel profound sorrow when a child initially shows improvement, but then deteriorates quickly. D. Early deaths often erode trust in medical teams. And the correct answer is C. Question number 17. Client with radiation therapy has mucositis. What should be included in their care plan? A. Providing hot tea. B. Using diluted hydrogen peroxide on ulcers. C. Promoting teeth flossing. D. Increasing mouth care frequency. And the correct answer is C. Question number 18. A 40-year-old woman admitted for mastectomy seems anxious and has many questions. The best response by the nurse is to A. Inform the client based on her capacity to understand. B. Address her questions during the recovery phase. C. Answer her queries when her anxiety reduces. D. Advise her to consult her doctor for her concerns. And the correct answer is A. Question number 19. When giving an educational session for a patient on lithium therapy, the nurse should inform the patient about A. Opting for foods marked low sodium. B. Enhancing salt intake in meals. C. Maintaining an adequate sodium intake. D. Eliminating sodium from meals. And the correct answer is C. Question number 20. When getting a patient ready for a surgical procedure, the nurse evaluates potential psychological issues that might lead to pre-surgery stress. Which of the following fears is considered to be the most unsettling for a patient about to undergo surgery? A. Worry regarding the impact of anesthesia. B. Dread of experiencing pain. C. Apprehension about the unfamiliar. D. Concern over alterations in physical appearance. And the correct answer is C.